Okay, good morning everybody. We are here to help you guys kind of walk through a basic wellness check. We've got our nurse here, Miss Theresa, here to help you guys kind of go through the basic things that you'll be able to test at home to help you guys just know kind of where you stand. There's also going to be a handout in your care packages today coming home with some main guidelines and stuff like that to help guide you through it. So she's going to just do some basic wellness checks on me. So hopefully this is beneficial for you guys, and yeah, we'll get started.
Okay, first of all, we're going to talk about getting your weight. Most people have a stand-up scale at home. Most people don't weigh every day, but if you were to have heart disease or like congestive heart failure, your doctor may want you to weigh every day. So just a few tips on that is to make sure you weigh every day at the same time, wear the same type clothing, and also use the same scale. It's best to weigh yourself before you go to the restroom in the morning and before you have drinks or food for breakfast. So then if you have a weight gain or loss of 3 pounds in 1 day or 5 pounds in 3 days, that's something your doctor might need to know, especially if you have heart disease and heart failure. So just keep that in mind to notify your doctor if you have a weight gain or weight loss in those parameters. Emily's going to be my guest today, and we're going to check blood pressure. You can do this at home also. The pharmacy sell wrist cuffs, or the cuffs you just slip your arm in. You can even have your blood pressure taken at the pharmacy if you aren't comfortable doing it yourself. Normal parameters for blood pressure is 120/80. Sometimes it'll run higher if you have high blood pressure, sometimes lower. Some of the symptoms of low blood pressure is dizziness, lightheadedness, blurred vision, things like that. Sometimes you don't have symptoms of a high blood pressure, but if it's really high, then you're probably going to get a severe headache, also some dizziness, things like that. Let me look at my paper. Sorry. Oh, you could even get some severe anxiety or shortness of breath with that high blood pressure. So if you feel like your blood pressure is high or too low, definitely give your doctor a call also. So I'm going to check Emily's and see how healthy she is. Put that over. Sorry.
No, you're fine.
So Emily's is good at 100/70. She's athletic, so that's a good blood pressure for her too. If you do check these yourself, the first beep that you hear is usually your systolic, which is your top number of your blood pressure. And the last beep that you hear is your diastolic, which is the low number of your blood pressure. So just keep an eye on that and listen at the same time. We're going to check her heart rate next. Just feel for the radial pulse. I'm going to do this one. We're going to feel for the radial pulse, and you want to take that for a full minute, and you want to be looking at the clock. So count the number of beats for a full minute, and the normal heart rate is 60 to 100. Sometimes it could be higher, and then that's probably something you need to notify your doctor if it's too much higher than 100. That means your heart is working hard. So the lower it is, the healthier your heart seems to be. So I'm not going to do that for a full minute, but that's how you do it. Respiratory rate, Normal is 12 to 20, and we're gonna watch her chest rise and fall. So sometimes when you're actually watching them like this, they can alter that because they're nervous or whatever. So if you just kind of, check their heart rate and kind of watch their chest rise and fall at the same time, but you're gonna be doing your own. So just the amount of times that your chest rises and falls, then you count that for a full minute. So. Okay, so that's how you check your respiratory rate. One other thing you can do, obviously your temperature. Now that the COVID's going around, you definitely want to check your temperature. 98.6 is the norm. Anywhere between 96 and 99-ish is normal for some people. If it gets over that 100.4 mark, that's when you need to probably notify your doctor, especially at this time with the COVID going around. It could mean infection. It could be, a variety of things while your temperature's up. So just keep an eye on that. The other thing you can do at home maybe is check for swelling in your legs and ankles. Usually if you can press in and leave an indentation, you probably have a little bit of fluid on your legs and ankles. So that's something you could also check at home. Yeah.
Okay.
I think that's about all that probably we could do at home. But yeah, like I said, you can always go to the pharmacy and have that taken too. So.
All right. Well, thank you, Theresa, for making sure I'm healthy over here. Hopefully that helped you guys out. If you have any other questions, you feel free to give us a call. And you guys have a wonderful Wednesday. We'll see you later. Bye.